Hi everyone. Today's session about the minimal need program. In shortly we can call it as MNP. I am Professor Dr. Beulah Dallas, HOD of Community Health Nursing Department, Triple M College of Nursing. The minimum needs program is designed to assist in raising living standards and in reducing the regional disparities in development. A need is something that is necessary for an organism to live a healthy life. Here the organism means the public or the people, especially rural and the urban slum people. It was launched during the fifth five-year plan between 1974 to 1978 to improve the living standards of the poor by providing essential social services focusing on rural areas and underserved population. The objectives of this minimum need program or the poverty alleviation, that is directly addressed poverty by ensuring basic necessities were met. Reduce disparities, aim to bridge the gap between developed and underdeveloped regions. Human resource investment, seen as a crucial investment in people's well-being for overall development. The principles of minimum need programs, mainly it is based on two classifications. The facilities under minimum need programs are to be first provided to those areas which are at present underserved so as to remove disparities between different areas. And the second main principle is the facilities under minimal need program should be provided as a package to one area through intersectoral area projects to have a greater impact. The other principles are to provide education, reduce slums, improve school teaching, improve nutrition, development of urban slum or rural area, development of social needs, prevention of disease, improve health system. The components or the sectors comes under the minimal need programs are, the first one is education, that is elementary and the adult education. Elementary, that is from 1st standard to 8th standard, and for adult education we can call it as Mudiyor Kalvi. So health, rural health services including primary health centers, that is 30,000 population covered by one PHC in rural, and in a hilly area 20,000 population will be covered by one primary health center. The water and sanitations, mainly the rural area, within 10 kilometers they can able to get the water. Energy, that is rural electrifications including street light and the individual house lights. Housing, homes for landless laborers, nutrition, special nutrition programs and midday meal programs. Slum improvement, that is environmental improvement of the urban slum. Under educations, they are concentrating mainly on the elementary educations, otherwise called primary education. Primary education means from the 1st standard to 8th standard, that is age between 8 to 13 years. Under the nutritional component, the midday meal program, ICDS program, goiter control program, vitamin A prophylaxis. Through that they are meeting the nutritional need of the rural and the urban slum population. And the main objectives of this nutritional programs were improve school attendance as well as improve child nutrition. The principles are supplement, not substitute to home diet. That means we can provide only minimal amount of that energy and the protein needed for the children, but not a substitute. This other requirement should be met by the parents at their home setup. So we can create awareness what are the nutritional advice we can give it to the parents, the preparation of snacks, preparation of breakfast, preparation of dinner, like that. And 1/3 of the energy and half of the protein requirements per day will be met through this midday meal program. And this menu that to be low cost, easily prepared at the school premises. Also locally available food can be used in the menu and frequently change the menu. Universalization of primary education by increasing the enrollment, mainly the first standard to fifth standard, and they can improve the nutrition status of the children. Mainly we can provide 300 kilocalorie and 8 to 12 gram of protein per day per students of this primary school children. The next component, rural and urban slum improvement. So employment creations and planned agriculture, house of poor, social security and pension, rural road connectivity, provision of credit at reasonable rate. So mainly in the panchayat in rural, they will be taking care of this. The employment creations, they will provide, they will create some self-employment and provide some skill-based training to the unemployed people, especially women and the youth. And planned agriculture and the house of poor, they are providing this free of cost, they are providing the houses to them. And social security and pension, minimum 1,000 rupees per below poverty level people, they are receiving it, and also the geriatric people also. Rural road connectivity, provision of credit at reasonable rate. If they want to start their own business or they want any other purpose, the panchayat will help them to provide the loan at the lower interest. How we can implement this minimal need program? There are two ways, that is, one is central state partnership, another implementation through area based approach. So central state partnership means the central government will provide the fund, and the state government, they will handle how to plan and how to implement that programs and how to improve it at the rural areas. Area based approach, that is, facilities were prioritized in underserved areas and delivered as integrated packages for greater impact. Let me conclude this topic. Minimum need program is providing essential need of rural and urban slum population. The minimal need program was a foundational welfare program shifting India's focus towards inclusive growth and laying the groundwork for the future poverty alleviation efforts. Thank you for your patience listening.